Bismillahirrahmanirrahim. Assalamu alaikum. First of all, I would like to say thanks to the organization committee ICAZ-2020 for giving me the opportunity to share my research idea. My name is Dr. Mahrukh Naseem and I am working as assistant professor in the Department of Zoology, University of Kurdistan, Quetta. And today the topic of my discussion is the synergetic effects of Ginkgo biloba leaf extract and Panax ginseng root extract on the carbohydrate and lipid metabolism gene in ALLOXAN-INDUCED diabetes. Diabetes is a chronic metabolic disorder and caused due to defect in the insulin secretion, and it is the third leading disorder of the world, and its prevalence is very high all over the world. And in Pakistan, it would become 10th leading. Pakistan would become the third leading country by the year 2030. And there are certain other complications which are associated with diabetes mellitus, retinopathy, nephropathy, neuropathy, cardiovascular disorders, strokes, and metabolic disorder are the most common complications. There are certain treatment which are available in the market, but these therapeutical treatment have certain health adverse effects. Therefore, the interest in the natural remedies are increasing all over the world in the last few decades because natural remedies have less health adverse effect, are compatible with the body, and easily available in the fruits and vegetables. We selected Ginkgo biloba leaf extract and Panax ginseng leaf root extract in our study. Both these are the Chinese herbs and contains a strong anti-diabetic, anti-inflammation, anti-cancerous properties, and of course the antioxidant properties. The active ingredient of Ginkgo biloba is flavonoid, and that of the Panax ginseng is the ginsenoside. So the main theme was to see the anti-diabetic and anti-hyperglycemic and anti-hypercholesterolemic activities of these two natural remedies in combination, and to see the effect on the glucose and lipid metabolic genes, and also the antioxidant properties of these two natural remedies in combination. For the experimental design, we selected the 40 ml Vistra adult rats fed on high-fat diet for 14 days, and then ALLOXAN, single injection of ALLOXAN was used as a diabetogenic agent at the rate of 120 to 130 mg per kg body weight. Because the ALLOXAN caused the necrosis of the pancreatic beta cell, to prevent the hypoglycemia, we used the glucose water. We gave the glucose water to the rats to drink, and after 3 days we checked the basal glucose level, and if we found the glucose level higher than 250 mg per deciliter, we considered them as a diabetic rats, and then divided into the following: negative control group without diabetes, positive control group, the diabetic group. For mixed group 1, we give the 50 mg per kg per day Ginkgo biloba, and similarly 150 mg per kg per day Panax ginseng root extract mixed with the standard diet of the rats. In MG2 group, we gave the 100 and 300 mg per kg per day Ginkgo biloba and Panax ginseng mixed with the standard diet, and in the MG3 group we used 150 mg and 450 mg per kg per day Ginkgo biloba and Panax ginseng root extract respectively. On the completion of trial, which was for 14 weeks, we collected the blood directly for the heart puncture of the rats, and separate the serum by centrifuging the blood. And for the following biochemical parameters, we also isolated the skeletal muscle, adipose tissues, and hepatic tissues, washed with saline water, and immediately stored at -80 Celsius. The RNA was extracted by using the cryosol method, and the RNA was reverse transcripted to cDNA by using the superscript 3 reverse transcriptase kit, and quantitative PCR was performed. Real-time quantitative PCR was performed by using the cytogreen, and we use these primers. These genes, along with primers for our study, GAPDH was used as a housekeeping gene. Medical analysis was done. Have a look on our results for the mRNA expression of carbohydrate gene, and we selected GLUT4 IR and IRS1 gene for the carbohydrate metabolism. For skeletal muscle, we found a significant increase for the GLUT4 in all the three treated group. For IRS1, only MG3 group showed a significant result for the skeletal muscles. As far as the adipose tissues are concerned, we found a significant enhancement only for the IR in all the three groups, and for the IRS1 in the last MG3 treated group. Hepatic tissues, we found a significant increase for GLUT4 and in all the treated groups, and a significant decrease was found for IRS1 only in the MG3 group. For lipid metabolism, we selected only PPAR-α in the skeletal muscle and found a significant enhancement in all the treated group. For TNF-α, we found a significant decrease only for MG2 and MG3 treated group in skeletal muscle. For adipose tissues, we selected FAS and PPAR-γ for lipid metabolism, and we found a significant increase only in the PPAR-α, all the treated group, and for TNF-α, a significant decrease was found in all the treated group in the adipose tissues. For the hepatic tissues, we found a significant decrease for the expression of SREBP1C in all the three treated group. For FAS, we found a significant decrease only in the MG2 group, and for TNF-α, only MG3 group showed a significant decrease. This is a table showing the status of certain certain biochemical parameters. We found a significant decrease for MG1, MG2, and MG3 group for FAS, but in a dose-dependent manner. For total cholesterol, only MG3 group showed a significant control, and for the rest of the parameter, we found a significant decrease in all the treated group, but in dose-dependent manner. So in conclusion, we found that these two natural remedies have a synergistic effect, but in dose-dependent manner, and have a strong anti-hyperglycemic activities by controlling, by regulating the gene expression of certain metabolic genes associated with the carbohydrate metabolism, and also show strong anti-hypercholesterolemia and anti-hypertriglycemic activities, as well as antioxidant properties by controlling the CAT and MDA. So thank you very much for your attention.